Bismillahirrahmanirrahim. Assalamu alaikum to all the audience and everyone who is joining us from different parts of the world on my TV, live, YouTube. So we are here today on behalf of IMI Women's Wing in this month of October. As you know that our cancer awareness series are ongoing, but because this month specifically is linked to breast cancer, so we have brought for you a program regarding breast cancer awareness, and we will begin this program with the recitation of holy verses. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم إنا آتيناك الكوثر فصل لربك وانحر إنا شانئك هو الأبتر. English translation. In the name of Allah, the most beneficent, the most merciful. Indeed, we have granted you, O Prophet, abundant goodness. So pray and sacrifice to your Lord alone. Only the one who hates you is truly cut off from any goodness. Sadaqallahul Azim. We will continue with our program, and for the audience who have joined us for the first time or those who know us, we would like to introduce you to the IMI Women's Wing through a short video, which we would be now playing for our audience. So let's go for the video.
Imami Medics International is one of the world's leading healthcare, humanitarian, education, and relief organizations that has been serving humanity for the past 27 years. What started as a noble effort of few friends in a New York basement has today mushroomed into a global initiative that has welfare projects running in 55 countries. Working for the poor, neglected, and disadvantaged people through various programs and helping improve their lives. Throughout history, the central role of women in society ensures stability, progress, and long-term development of nations. Since its inception, women volunteers at IMI have played a foundational role and acted as a pillar of relentless support in its long, painstaking, yet rewarding journey. IMI's Women Auxiliary is a platform for the motivated and inspired women that are ready to change their world for the better. IMI Women Auxiliary is a step towards empowering women through provision of education, health services, and various training programs. To fulfill these, IMI's Women Auxiliary organizes seminars, skill development workshops, e-training and support sessions, career guidance, and financial support initiatives. Through its various working groups, the Women Wing intends to educate, change, and implement policies which help accelerate women's sustainability around the world. From transferring latest medical technology and research to students in war-torn Iraq, to providing primary, basic hygiene education to girls in impoverished Nigeria. Helping design innovative techniques to fight coronavirus in India, helping girls prevent childbirth mortality in Thar Desert of Pakistan. Free basic healthcare screening for the elderly and people without insurance in the US. Supporting future leaders with Flagship Nest program in New Jersey, an all-expenses paid initiative where foreign medical students receive free stay, food, and career guidance. Zahra Social Networking, an initiative to address social issues such as mental health amid COVID-19. Women's Wellness Program that aims at educating women in adopting a healthy lifestyle. All these wonderful initiatives are possible thanks to the combined experience and knowledge of the diverse set of medical experts, academicians, and social workers that are an integral part of IMI's Women Wing. Yet, there's still a long way to go. Much more remains to be achieved, and through each step, we will need your prayers, financial support, and active participation. Our vision lies in growing IMI Women family one meaningful wing at a time, adding new members in our journey to empower women worldwide.
So I hope that gave everyone an insight into the IMI Women's Wing very briefly. And from here onwards, inshallah, our moderator and speaker will continue the program. And before going there, I would like to introduce our moderator for today's program, Dr. Varda Zedi. Dr. Varda Zedi has just finished her internal medicine residency at Wayne State SOM. She graduated in June 2023. And she is currently working as an internal medicine primary care physician for Corwell Health in Grand Rapids, Michigan. We welcome you, Dr. Varda Zedi, and we request you to please take the program forward from here, introduce the topic and introduce the speaker. Over to you, Dr. Varda.
Thank you so much. Assalamu alaikum, everyone. I'd like to welcome you to our second episode of the IMI Women's International Breast Cancer Awareness Talk. Today, we have a guest speaker, Dr. Amina Naqvi. She is a graduate of Allama Iqbal Medical College. She did her residency in internal medicine and fellowship in hematology oncology at New York Presbyterian Brooklyn Methodist Hospital. She's worked in both private practice and in the academic setting. And most recently, she's an assistant professor at Emory School of Medicine. So thank you so much, Dr. Amina Naqvi. Very glad to have you here today. And thank you for educating us as well.
For the kind introduction. I'm very excited to be here.
Perfect. So I do want to let everyone know, because you are viewing this on the YouTube link, if you have any questions, any concerns, comments, please comment them over there. So let's begin, Dr. Naqvi. I'm going to just share this so everyone can view it. All right. So let's get started. Dr. Naqvi, how do you start screening for breast cancer?
Wonderful question. So let's start by saying, why do we need to do screening in the first place? So breast cancer is a very prevalent cancer. It's the second leading cause of death among women in the United States. 1 in 8 women will get diagnosed with breast cancer throughout their lifetime. This year alone, we had 300,000 cases diagnosed with breast cancer in United States alone, in women only. There are about 4.4 million women who are living either with a history or with an active disease at this time in US. So as we look at what can we do for a disease that is so prevalent, so screening or identification of the disease by a method that can identify it at an early stage is very helpful. And this is a mammogram that I am sure everybody is familiar with. It's just a simple X-ray of both breasts, and something that has caused revolution in the lives of women. And that can simply be seen because over the past 40 years, breast cancer death rate has decreased by about 43% thanks to early screening. Okay, there are some studies where they actually compared the populations that were screened versus the populations that were not screened. And they found that the population of women who were screened, they actually had a reduced death risk by 26%. So I think that by itself tells you that mammogram or screening mammogram is something that's very necessary. Now, the guidelines by US Preventive Services Task Force actually recommend that screening be started at the age of 40. And it needs to be done every other year till the age of 74. At the age of 74, it is an individual decision that needs to be discussed between the primary care provider or any healthcare provider that the patient has based on their associated comorbidities, means health conditions, and how much life expectancy do they have. And when we say the screening needs to be started at the age of 40, it is recommended for the patients who have an average risk of breast cancer.
Okay. Okay. Yes. So what if women are going through mammograms? If there is something that's found on the mammogram, I know that can be very stressful for a lot of people. What are the most common findings of a mammogram?
So the mammogram will find practically a lot of things that are benign, and there are things that you don't have to worry about.
Mm-hmm.
Reason why we are doing this widespread screening, because we want to really identify the cancers at a very early stage. But find things like calcifications, those are small calcium deposits, either micro, very small, or relatively larger throughout the breast. And see some lumps or small masses, as well as we can see cystic structures that are like fluid-filled sacs. Management is all variable, as we are going to discuss that further.
Mm-hmm. Yeah. So if, let's say, on a mammogram, any of these things like cysts, calcifications, or even a solid mass, what would be the management? What would we start educating patients on?
So I would say the first thing is, when you do a mammogram, there are areas that American College of Radiology has put in place in terms of when we identify any of these things, any of these three things, and they have put it into a criteria where they will send you a result, something like saying whatever they found on the mammogram, either cyst, mass, or calcification, it is divided into various categories. And it is described in terms of BI-RADS. I'm sure you have seen that. So the BI-RADS is something they identify as if it is something like BI-RADS 1. It's essentially something that is benign. So you don't have to worry about it. And you actually just can continue with your routine screening mammogram. Same is true for BI-RADS 2. When things becomes BI-RADS 3, that means that it needs closer follow-up. Maybe you need to come back for another mammogram, or in 3 to 6 months, or you need to come for a clinical exam. So things change based on the BI-RADS that we get from the initial mammogram. Now, if something is BI-RADS 5, that is highly suggestive of malignancy, right? And if you find something like that, then there will be different steps that we will take. So I want to mention a couple of things. Calcifications. So calcifications can happen from aging, previous trauma, fat necrosis. So all calcifications are not problematic. Similarly, there are things like previous inflammation could cause calcification. They could absolutely be associated with precancerous as well as cancerous lesions. So then again, the criteria will be used by the radiologist, and that will guide through the whole process.
Okay. Okay. Yes, this is all good information. So let's, I do want to give everyone some cases so that they have an idea of different age groups and how breast cancer affects them. So let's give an example today. Our case one, 25-year-old female with a family history of her mother having breast cancer. So in this particular patient, at what age should we start screening? And then are there any screening tests for women with breast cancer in the family? Or is there anything different that we have to do?
So first, let's go to a simple answer. So if her mother had breast cancer, she has no other risk factor, no other family history. She would go for a screening mammogram 10 years prior to when her mother was diagnosed with cancer, right? So that information is important. And also, you will start a screening mammogram roughly at the age of 30, because prior to age 30, the mammogram is really not helpful because of the breast density, right? So the one thing that I want to bring up is that when you see a patient who comes with this history, there are two models that really help you identify if your patient is actually a high-risk patient, or is this patient has some family member who just got diagnosed by chance with a breast cancer. So the two models are called Gale model, and this is something that anybody can do on their phone. I mean, patients can do it themselves, or their primary care providers can do it for them. The other model, IBIS model. So basically, it's like a couple of series of questions in which you ask the patient about their age, their nationality, because that impacts the risk of breast cancer, and age when they had their first period, if they had any previous biopsies, what were the results of their previous biopsies, if they have any family history. So these help to identify those patients who have a significantly higher risk. So now we are separating that from this patient. If this patient only has this history, then she is not actually high risk. But based on Gale model, if your risk is 1.5 times, where normal risk is 0.5, or if your lifetime risk is about 15 to 20% of having breast cancer throughout your lifetime, then we put them into a separate bucket called high risk patients. Their screening is very different. So those actually will come at the age of 21, and you would want them to have a clinical exam every 6 to 12 months. They will start screening MRI at the age of 25 if the youngest person in their family was diagnosed at the age of 35. And they will start a screening mammogram at the age of 30 if they do not qualify for the age of 25, right? So they roughly would do alternate MRI and mammograms starting at the age of 30 for the higher population that we can calculate from the Gale and IBIS model.
Okay, very good. Yes, I think that these are things that I don't think the usually older patients are told, but not the younger ones. So things can definitely get missed. All right, so then we have another case. So we have a 35-year-old female with a family history of ovarian cancer in her grandmother. Is there a link with breast cancer?
Yes, absolute link. There is very well documented entity called hereditary breast ovarian syndrome that is actually linked to some kind of mutation in our genes that normally repair some kind of defects. So as the wear and tear of life, your cells go through processes where they have damages inside, and our body mechanism that can actually correct these damages, and that's how we prevent from damaged cells from continuing to grow and making things like cancer. So when that defense mechanism or your repair mechanism is defective, that's when your risk of breast cancer and ovarian cancers increases significantly. These very well-known genes are BRCA1 and 2. They actually increase the risk of breast cancer by more than 60% throughout the lifetime. And they also increase the risk of BRCA1, more increases the risk by 40 to 60% for ovarian, and about 15 to 30% BRCA2 for ovarian. So they are the two genes that we will be looking for. And this patient in particular, she definitely qualifies to have testing done because she has a second-degree relative who actually has ovarian cancer. So there is one of those where if you have a first-degree or second-degree relative with ovarian cancer, you qualify. I do want to bring up that the best thing for any person who's interested in getting to know about their genetic history and all that, the best person who should be tested is the patient themselves, because there are too many syndromes that would involve having multiple cancers. So if you know what caused the cancer in the patient, that would kind of help you also identify the genes that you should be looking in for your patient.
Okay, so there's a question that comes up in my own practice a lot. I get a lot of young girls that get nervous, especially with their family history. At what point should we start discussing genetic testing? What is genetic testing and is it accurate?
Okay, so genetic testing is you can say, so the genes are kind of like the message that we are carrying through our generations, and that kind of make us who we are, right? So this is like the message or the information that comes from our parents and from their parents, and that kind of constitute or make us who we are. Some of the genes are the ones that are pathogenic, just like the ones that I mentioned, they are passed through generations. So some criterias that I would say we can look into, where you can refer your patient for genetic testing. And they have a family member who is diagnosed with breast cancer under the age of 45, and also has ovarian cancer, right? So I would actually go over there about 5 to 10 criterias, and I can go over them so that we can just understand that having an extensive family history is very important when patients ask a question. First, second, and third degree relatives. If you have a combination of 3 relatives with breast cancer, that's one of the indications. If you have breast and ovarian cancer in the same patient, if you have bilateral breast cancer in the same patient, if you have epithelial ovarian cancer, exocrine pancreatic cancer, and high-risk prostate cancer. So these are some of the things that you can put down as, there are the NCCN guidelines, basically, that recommend that these patients who are coming to you and they themselves are not affected, but they have family members, multiple of them who are affected, they actually make the patient eligible to be tested for these genetic tests.
Okay, makes sense. Thank you. And then the next section, I just wanted to discuss with the next case. The last 2 cases were young females. Now, if we have an older female, 65-year-old female with a solid mass, what would be the next steps for her?
So, yes, so being a female, a risk factor, older age, more than 50, it's a solid mass. So they are all suspicious. And the next step is anytime you find a mass on a screening mammogram would be a diagnostic mammo to get further information regarding the mass, as well as to also see if you are seeing, in addition to mass, any additional lymph nodes in the area. Okay. Next step would be doing a biopsy. It could be a sonogram guided biopsy or incisional biopsy based on wherever the patient is located. And whole purpose is you want to try to get the tissue so that this tissue can be sent for pathology to identify that if this mass actually represents a breast cancer. So if this is breast cancer, as we are discussing this today, we know that breast cancer is a very heterogeneous group of diseases, and it's not just one entity. Just the diagnosis of breast cancer by itself does not tell you how well you are going to do. There are multiple things that matter. Mostly the staging. So the staging of the breast cancer actually involves, just as we mentioned, the mammogram and sonogram. So if you just have a very small mass in the 2 centimeter, it's going to be stage 1. If you have lymph node involvement and it's a larger mass, you will have locally advanced or stage 2 to stage 3 disease. If this disease is spread, that you can obviously identify by doing testing like CAT scans or PET scan to other organs, then it becomes a stage 4 disease.
Okay, very good. Yes, these again, I think usually when I get these older patients, they're very nervous. So educating them, really helping them understand is very important. So if there is breast cancer in the family, is there any way that we can prevent it? Even if it...
Yes. So even though we understand that it runs in the family, people could have even a genetic mutation that puts them at risk for this. There are modifiable, or there are some things that you can adopt to basically is your secondary risk. So you have an inherent risk because you have a family history, and being a woman, and as you're going to age, all these things are going to add up to your risk of having breast cancer. So the things that we try are a couple of them. One, the hormones. So there's a lot of debate, and it's something that people discuss more and more, and there's more and more trend where people tend to think that the risk is fairly small. So the risk might be fairly small, but for high-risk patients, this risk is something that they really cannot afford. So in terms of the oral contraceptive pills, as well as the hormone replacement therapy that is given to patients during menopause. So both of those will increase your risk as you take for a longer period of time and while you are taking them. So even has to use them, I would suggest maybe taking them for minimum period of time, and also understand that when you stop taking either of these two, 5 years after stopping that, your breast cancer risk goes down to where it would be if you don't take them. But for high-risk patient, I would say maybe staying away from them would be helpful. Another thing that has been proven to be beneficial is maintaining a healthy BMI. And it's a very important thing, because there is more and more data that is coming out how increase in adipose tissue and fat cells in the body can create more estrogen that can in turn stimulate the breast tissue and lead to the creation of the breast. So I would say there is data that suggests that maintaining a healthy body weight that's between a BMI of like 18.5 to 24, the risk was substantially increased in postmenopausal patients when they, especially when their BMI was more than 30. Okay. In terms of premenopausal patients, however, it was different. They did not see a direct link if they were obese, but they did see that the risk of benign breast disease increases when premenopausal patients are obese. And that had some link and later on developing into breast cancer. So that is another thing, maintain a very healthy BMI too. Okay. Absolutely.
Yeah. So, just going kind of on that topic, many of my own patients, I'll educate them on diet and exercise, but sometimes they come to me with alternative or herbal medications. Do you know of any, or are they even effective for breast cancer?
So, there is a lot of debate on this topic as well. And even though there are things that you can take, link that is proven to help benefit the patient in preventing the breast cancer is very weak. So you just also have to understand that many people talk about things like turmeric or different kind of vitamins. And vitamin C is something that we all understand has very high antioxidant properties. I hear all kinds of names. The problem is that the doses that you would require for these supplements to actually cause that impact that you are looking for are extremely high. That are not feasible. And in the small doses that we take them, they practically do not help in preventing breast cancer. There are some things that you can, I would say, kind of try to maintain or keep to kind of keep yourself healthy. Like one of the things that people talk about is vitamin D, and I do want to bring that up because there is clear suggestion that if your vitamin D levels are low, you are at for having certain type of cancers. However, if you have normal vitamin D levels, that does not mean, so anybody who tries to take supplements when their vitamin D level is normal, it's not going to help. So just maintaining a healthy vitamin D level or rest of the micronutrients, and you can go to somebody who practices like naturopathic or alternative medicine to just make sure that your body has adequate amount of nutrients that you need for a healthy body functioning. Have a direct impact, but just maintaining a healthy environment inside the body can just reduce the oxidative stress or an environment that can promote the breast cancer. But unfortunately, at this point, I would not say there's something that I can just suggest that it is proven to help reduce the risk in terms of alternative or herbal medication.
Okay. Yeah. And I think even just that point of vitamin D, I know a lot of Muslim women that are, wear hijab or are less exposed, or culturally we like to less expose ourselves to the sun. Their vitamin D levels, every time I check them, usually I have to put them on higher doses of vitamin D. So, definitely go to your doctor and get all these things checked annually to make sure you're healthy overall. Even if there's nothing wrong, it's good to know. So that way, you can prevent things from happening. Let's say if we have a patient that has breast cancer already, do you know of any alternative medications that would work for them, or, decrease the burden? Do you get these patients where they ask these questions?
We always get patients who ask this question. I do think that there is an inherent fear about everybody thinking that once they are diagnosed with cancer, they are going to be dealing with chemotherapy. And I do want to reassure, if anybody has that belief, breast cancer actually has changed so much in the recent years because of early detection, that most of the time, when we find an early stage cancer, most of the women would not need chemotherapy. They would need a simple pill that decreases the concentration of estrogen in their body. So something as simple as an agent that would reduce the estrogen in your body can actually prevent the recurrence or prevent the breast, or can be used for the treatment of breast cancer. So I think the most important message for this would be there's unfortunately no alternative medications. And there was a study that was actually published in 2021 where they actually were able to prove that any patient that chose to go for any kind of alternative therapies, they actually did very poorly. Their mortality was significantly increased. So that is something that I really want the patients to discuss with their provider. If they're not very happy with the provider, they can get a couple of opinions to just reiterate the fact that most of the providers would agree the treatment is most of the time fairly simple and well tolerated.
Okay.
So no medications at this time.
Yes, yeah. And I think that's very important to, help people understand that, of course, when you start chemotherapy, it's not, the side effects are there, but, supplementing with that diet and exercise, getting those healthy, nutritious foods in is very important as well, just as an overall suggestion for everyone. Are there any diet measures that we can do to help decrease the risk of breast cancer?
So this again goes back to the things that actually promote your breast cancer risk, right? Just having a higher BMI causes us to have high risk for breast cancer. So foods that are more healthy, I would say actually exactly the foods that your mom told you to eat. So the fruits, vegetables, less processed foods, foods that are high in antioxidants. And there are two main groups that I wanted to bring up. The foods that have low glycemic index, and that are actually, a lot of that include fruits, but it also includes your meats, like the fish, the white meat, and things like that. So low glycemic index foods are the ones that actually do not cause insulin spikes in your body, right? So there is some question that when we go through a process, when you eat something and it causes kind of a sugar rush, or your sugar all of a sudden spikes, as a result of which your insulin spikes. So we do think that that creates an environment that is a risk for inflammation. And in turn, it is a time when you are going through that cycle that your immune system is suppressed, and you're at higher risk for developing the environment or microenvironment that would promote something like a tumor. So low foods are very important. The same way, I would say there are some foods that are linked to phytoestrogen. So there are some foods that are actually protective. And those are the ones that we have a lot of studies done on them. I cannot say that you can take them as a treatment but they are actually well documented to kind of like possibly reduce the risk of breast cancer, and they can come from products like soy products. They can come from legumes, grains, your beans, and things like that. So they can also.
Okay, very good. Yeah, and I think just on that topic, even when we are eating all of these foods, to make sure that we're not, changing the chemistry of the food, so overcooking them, eating them whole, not, putting so much oil and things like that, that really does change the nutrition. So you want to be able to eat it as whole as you can, and making sure that that's something you're watching out for. So I actually get this question a lot. A lot of my younger patients, especially with the social media, especially with what's on the news, or when you go to the grocery store, there's so many different types of foods and products. And recently there's been a lot of marketing when it comes to dairy products, such as drinking milk. Is there an increased risk of breast cancer, especially in like these North American countries like Canada and the US?
So I will tell you that there was a study that came out in 2020. I think it included about 33,000 patients, and actually kind of emphasized a lot about how drinking more milk was associated with higher risk for breast cancer. But over the years, we have about 20 to 30 studies that have been done on the nearly same topic, either milk or dairy products. And there is actually no real association between drinking milk and high risk of breast cancer. Milk does contain vitamin D, so they did think that even if there were some risk that were imposed because of the hormones that you get from the milk, that was kind of counteracted by the positive or the good nutrients or vitamin D that is found in the milk. So if you want to nutshell it, you would say, actually, no, you can absolutely drink your milk. Now, I do want to say one thing. So if somebody drinks 5 glasses of milk, that might be something that you do want to. So limit your dairy products to 2 servings a day. And one of the reasons is because we do know that because we are trying to increase these milk supplies and all that, so they are being exposed to hormones, growth hormones. And many of the times when we are not able to establish the risk at this time, it does not mean that there isn't no risk. So I would say moderation of everything works. So even though we cannot prove it as of yet, we can just keep it at 1 to 2 servings a day.
Okay. So kind of having a balance of everything. So this is another one. I see some patients. Is there many cultures that have a lower risk of breast cancer to those compared to that are living in the US or Canada? Is there a reason for that at all that you've seen in your own practice?
So I actually had to look this question up because I do know that, in the past, we always had this thing that where we would talk about in Asia and other countries, there tends to be lesser risk of breast cancer. And I just saw an article that was published in 2022 that actually showed the same ratio, that it was much less in Asia as compared to in more like Western countries. And one of the reasons they would say is lifestyle, to processed foods. So I think we have talked about the risk factors, but I would say when we are looking at the risk factors, it's more like related to your lifestyle. So, and lifestyle mean they are saying we tend to be more sedentary. Maybe it's because you can order everything online and don't even have to do groceries anymore. So more sedentary lifestyle, that's one. Then more processed food. And also there is some link about Asian countries where they did suggest that they do use some more phytoestrogen or soy-based products, especially at a younger age. They think could be possibly one of the reasons that could be protective, but that has not been proven. So these are factors. And I do want to say one more thing. We do not have as vigorous of screening, at least in many other countries, as we do it in countries like US, Canada, and that might be one of the components that is showing as breast cancer being less. And I understand that there are countries that are very advanced, but I also understand that many of the countries don't follow these guidelines.
Right. Yeah. Because then it's a little bit of a bias, study, because you have to equally have mammograms on both sides. So that definitely makes sense. All right. So thank you so much. I think we'll take some questions from the audience, and we have some good questions. What kind of impact does stress have on breast cancer?
So I would like to say a lot.
Yeah. Yes.
No. So actually, there are a lot of studies done regarding the role of stress. There is no proven association between stress and development of cancer. I do want everybody to understand that when you are stressed out, your hormone imbalance, that is that can actually put you in a state of constant inflammation. And even though we cannot prove that this is causing more breast cancer, or like stress by itself is causing, but I can very well imagine that it could potentially lead to changes in your body or your lifestyle, where you may become more sedentary, you may gain more weight, you may make unhealthy choices in eating, and indirectly your risk would increase. But stress by itself, no.
Okay. Yeah. Yes. And this is another good question. Can breast cancer affect the menstrual cycle in women?
So, okay. So breast cancer would not affect the menstrual cycle. Now, the treatments for breast cancer are totally on the other end, right? So if somebody is diagnosed with a breast cancer where they're going to require like chemotherapy, that absolutely would cause them to stop their periods. Sometimes this could be a temporary stop, like they can resume their periods. However, breast cancer by itself does not impact your periods. Some other things that we do actually create environments sometimes for younger women to create a postmenopausal state, as we do know that estrogen in their body, if their cancer is more specifically hormone driven, that I'm sorry. So if their cancer is hormone driven, we do know that having the premenopausal level of estrogen is not healthy for them. So we do create environment for them, but by itself, no, it does not impact your menstrual cycle.
Okay. And then we have another question. For women previously exposed to radiation for treatment of other types of cancer, does it increase the risk of breast cancer itself?
Absolutely, very good question. It's one of the absolute risk factors. So patient is diagnosed with any kind of lymphomas or any tumors in their childhood, so they absolutely actually would follow the guidelines for your high-risk patients that we talked about.
Okay. Yes, that makes sense. Yeah. All right. Thank you so much, Dr. Naqvi. It was, I think this is all good information. And of course, if there's any other questions or concerns, we can definitely address them in a different episode. But I'm going to give it back to the Women's Wing team, and then we'll take it from there. Thank you.
Thank you very much.
All right. That was, I mean, a lot of great information. So I would like to thank on behalf of Women's Wing to Dr. Amna Nakui, and I would like to thank our moderator, Dr. Verda Zedi, and I would also like to thank our media team, Sarah Shert, and on behalf of Dr. Huma, the Global Chair of IMI Women's Wing, I would just like to mention that this was in continuation of our cancer awareness series, that this was the month of October, and we tried to bring something which can spread more awareness to the women all around the world. And thanks to our speaker and our moderator, it was a very informative program. And we hope to see you in our next episode soon, inshallah. Thank you once again. Till then, take care and Allah Hafiz.
Thank you so much.
Thank you.
Thank you.